Okay. All right. So you can see my screen, right?
Yes, sir.
All right. We talked about the thyroid gland a little bit yesterday. What can you remember about the thyroid gland?
Mm. You talk
Mm-hmm.
um hypothyroidism, hyperthyroidism, the
No, the
question.
thyroid hormone itself. What does the thyroid hormone do?
Okay, we didn't talk about thyroid. Okay, thyroid hormone. Shoot, what does it
Okay.
do? I can't remember, but I know it's in the neck region.
No, the
Thy-
hormone. Yeah, I know the thyroid gland is in the neck region, the anterior neck, but the hormone is responsible for metabolism.
Oh, yes. Think about it.
Yeah, it's responsible for metabolism. If we have it in our body system will be able to metabolize. When we have metabolism, it deals with the breakdown of glucose to generate energy. It deals with our body system getting the energy they need to work, our heart
Mm,
to function well, our muscles will contract well.
mm.
Everything will work fine. Then when it is too much, what happens?
Um, Over excitement of those organs.
Yeah, there will be excessive excitability of those organs. There will be too much of metabolism, too much of energy generation, and
That
we'll be
I
wasting
saw.
energy. Yeah. So, if a patient has too much of thyroid hormone, what do you think will happen to the patient's weight and why?
The weight.
Mm-hmm.
The weight will go down
Why?
because it's exerting too much energy because of the impulse that is being provided as a result of the excite too much excitement.
Yeah,
Or like
absolutely. It's like when the demand is more than supply.
mm,
When the energy you are generating, you are using is more than what you are getting, so you will lose weight. What
mm.
happens to your heart rate if your thyroid hormone is high? What happens to your heart rate?
Okay, so the heart might start malfunctioning. So the heart rate will
Heart
be
rate, okay.
the heart rate. Hold on, it will be high.
It will be high because your metabolism. See, metabolism is almost everything about your body. When metabolism is high, your body is working so hard to be able to meet up, because the body is requiring so much energy, so much power, and then it has to generate that power for the body to continue to move on. So your heart rate is going to be high. Your muscles will contract. What happened to your stomach? Is it going to be diarrhea or constipation?
It's going to be diarrhea
Why?
because the body is not relaxed. If it's relaxed, then it's constipation, like in hyper.
Perfect, perfect. The body is not relaxed, so there'll be increased peristaltic movement.
Yes.
Okay, there will be increased peristaltic movement. What again do you think will happen to the patient's sleep? Will the patient sleep too much, or will have a problem sleeping? Will have insomnia?
Oh, we have insomnia.
Will have insomnia.
Mhm.
Perfect. So is just to give you an idea of when somebody has too much of it. We've not talked about it, but you are getting the answer because you are putting your imagination into action. Okay. Yeah, when you have too much of it, they say too much of good thing is bad.
Mhm.
Even though we need the thyroid hormone to work well, to work for us, to help us to get energy. But when it is too much, you become restless. Your body will be contracting, everywhere will be restless. Your eyes will bulge out because you do not have you have too much of thyroid hormone. It's just
Mhm.
like when your car is moving, it's moving fine, it's okay. But what happens when the car continues to move in a higher speed?
Mhm.
Everybody wants their car to run, right? Everybody wants to drive a fast car. But what happens when the car is in a higher speed and cannot stop? It can crash everywhere where it's not supposed to go. So that is how the thyroid hormone works. Now let's go to the other side. What happens when there is no thyroid hormone, or when it is just little?
when it is little. That
Yeah,
is,
what happens to the patient's weight?
he gains weight
Why?
because he is cold, he's calm, the body is relaxed. He gains.
Ovary, it's relaxed. I gave an example of a car moving. If it's too fast, it's dangerous. If it's also too slow, it's of it to be moving at 40 miles, it's moving only at 5 miles on the highway. What happens? It's also dangerous.
Mhm,
So you won't say that one is normal because the person is driving at a low speed. It's not also safe. That's why some cities will have high limit and low limit of speed. So thyroid hormone, when it is too low, it's also not good because
mhm,
your body is too relaxed and it cannot function
mhm,
because you need energy. You're not no energy because your body is not generating energy. No thyroid hormone.
mhm,
Your weight is increased because even the little food you eat, your body is not using it because your body does not need the energy.
mhm.
Yeah. Your sleep, you become so sleepy, which is the opposite of the other one. You become so sleepy. Your heart rate will drop. Your intestine will not contract well because everything is just so sluggish. That
Mhm.
is hypothyroidism.
But the skin is okay. In hyperthyroidism, I read in hyperthyroidism, if I can remember, they have a beautiful skin.
Yeah, but
That's it.
hypo they have pigmentation because
Yeah.
of the ink because of accumulation of adrenocorticotropic no thyroid stimulating hormone, sorry. Because of accumulation of thyroid stimulating hormone, because the thyroid is not working. So there is accumulation of thyroid stimulating hormone that will cause pigmentation. It will activate the melanocytes on the skin to produce high amount of melanin. So there is hyperpigmentation of your skin in hypo. Okay, so we are going to talk about it a little bit. These are the actions of the thyroid gland. Let me get my pen. Oh, don't like to use. Okay. Have it. All right. So when the thyroid gland is working, there is rise in oxygen consumption. Because the body needs glucose and oxygen to do what? To metabolize, to generate energy. So because there's enough thyroid hormone, there's rise in oxygen consumption. Then there's production of metabolic products such as CO2. There'll be production of urea, production of all the metabolic products. Now, there will be vasodilation because thyroid hormone causes vasodilation
Tell me about
normally.
dilation again.
Vasodilation is when there's dilation of the blood vessels.
Okay.
Yeah, when there's dilation of the blood vessels. Blood vessels, when they dilate, what happens to the blood pressure when they are dilated?
It comes down.
What happens to the blood pressure when they are constricted?
It's high.
It's perfect. So now, but it does not necessarily mean that patients with thyroid hormone are going to have hypertension. Now, there's also increased cardiac output. So when there's increased cardiac output, what happens to blood pressure?
It's high.
When there's reduced cardiac output, what happens to blood pressure?
It's low.
It's low. So it depends on which one is more active. If the vasodilation is higher, then there will be low blood pressure. But if the cardiac output is higher, there will be increased blood pressure. So these are we've talked about motility in the GI. We've talked about muscle contraction. So these are all metabolic activities. Okay. Our body is continuing to function, to contract, use energy, do what they're doing. Everything is just working fine. So, but then we'll first talk about hypo now. What is hypothyroidism? What is hypo?
Hypo means low.
Low what?
Low thyroid.
Are you okay? You seem tired today.
No, I'm not tired.
You seem tired, yeah.
I'm trying to think. Is it like say low T3 and T4?
Yeah, low thyroid hormone. That is just it.
Okay.
Yeah, low thyroid hormone. Now, what can cause hypo? Just imagine, what do you think can cause hypo?
That cause hypothyroidism.
Mhm.
Mm.
Because how NCLEX to tell you is a patient is doing this and has this thing. What are the complications, or what do you assess in this patient? What are the priority assessments for this patient? So what can cause hypothyroidism? The number one is what we call Hashimoto's thyroiditis. It's an autoimmune condition.
Mm.
It's an autoimmune condition that the body's immunity is destroying the thyroid hormone.
Mm.
The body's immunity is destroying the thyroid hormone. That is the number one cause of hypothyroidism. Which the number two, well, not number two basically, but it could be congenital abnormality. When there's a congenital abnormality that the thyroid hormone, thyroid gland is not developing, congenital abnormality. It could also be from a patient that has hyper. When somebody has hyper, how do
Mm-hmm.
you manage the patient? You remove the thyroid gland, right?
Mm-hmm.
So when they remove the thyroid gland, the patient does not have a thyroid gland again. So there's no production of thyroid hormone. So that can result in what? Hypothyroidism.
Hypo. Yes.
Yeah, treatment of hyper, such as thyroidectomy or with radiation, can also cause hypo.
Mm.
Now, there's also the patients who use what we call lithium carbonate. You know what lithium carbonate is?
Lithium is for psychiatric
Yeah, it's a
patients.
psychiatric, yeah, for what condition? It's a mood stabilizer.
Muslim.
Yeah, it's a mood stabilizer. We use it to manage somebody with manic depressive state because they are just switching from mania to the depression, from depression to mania. So we need to stabilize their mood. But then it can result in hypo because it destroys, it suppresses thyroid hormone.
Mm-hmm.
Does that make sense?
Yes, sir.
Yeah, and then another one is a large amount of amiodarone. Tell me what amiodarone is.
Amiodarone is for what's amiodarone again? Now I say I don't know medication. It's for amiodarone. It's not for blood to bring down blood pressure.
Not blood pressure. It's an antiarrhythmic agent. When the heart is pumping abnormally, amiodarone will control its right to start pumping regularly when there's irregular heartbeat. But then amiodarone, one of the side effects is hypothyroidism.
Okay.
Yeah, so a patient may be asking, NCLEX may ask you, oh, a patient is diagnosed with arrhythmias, and the doctor prescribed amiodarone, but the patient, forgot and was taking excess dose of amiodarone. What complications would you suspect? So it could be hypothyroidism, would be a problem. And then finally, antithyroid medications such as propitouracil. Propitouracil is a carcinogenic, anti-carcinogenic agent. We use it it's a chemotherapy, but we also use it to manage hyperthyroidism. Okay.
I gave it an acronym. PIPM. Propyltyrosine iodine.
Uh-huh.
I can't remember the many P and the other
Met,
M.
yeah, propitouracil, iodine,
Uh-huh.
metimazole, and I don't know which other P. Well,
I
propitouracil.
gave it an acronym when I was reading.
Oh, okay. Oh, that's what you were remembering.
Yes.
Yeah.
Uh-huh.
So these medications can block the synthesis of thyroid hormone. Okay. Now, don't forget the function of thyroid hormone. Don't forget the functions of thyroid hormone. Now, let's go. We've talked about the clinical manifestations of hypo. We've told you that everything is hypo, everything is slowed down. So heart pulse rate is going to be slow. There will be cold intolerance. Why would they have cold intolerance?
For hypo,
For hypo,
because activity is low.
it's low. So why would it cause cold intolerance?
So why we have cold intolerance?
Yeah, why would it cause cold intolerance?
Okay, because blood determines our temperature, right, in the body.
Well,
So
blood is a factor.
okay, since the person is relaxed, and the activities in the body is not going on so much.
Simply, the muscles are not contracting.
The muscles.
When we are cold, what happens? We shiver. When we shiver, what are we doing?
We are trying to
Generate
and
heat.
okay.
Heat. When the muscle contracts, that's why we shiver when we are cold. But when we are hot, the body, so yeah, that is because of that. Then weight gain, you know why there is weight gain, right?
Yes.
Okay. Their hair is usually dry and brittle. They lose their eyebrow. You see them, they lose their eyebrow. And then what again? They have edema on their faces because the fluids are not being used, so they accumulate on the faces, accumulate on the skin. There is also peripheral edema on the hand and the feet. Can you see? And then
Yes.
there's also muscle weakness. We've told you that there will be constipation, right? You know why there's constipation.
Yes.
Okay. And then yeah, so then they have menstrual issues. They have menstrual issues. So,
Okay.
how do you treat a patient with hypothyroidism? Now, regardless of the cause, let's say the patient doesn't have thyroid gland again. How do you treat the patient?
No time again.
Hypothyroidism generally, how do you manage it?
Okay. Um, you try to warm up the person, cover with a
No,
blanket.
no, that is to manage the symptoms. But how do you manage when the blanket will not blanket will only protect the patient from cold, right?
Mm.
But will it protect you from low heart rate? Will it protect you from edema? Will it protect you from all other signs of hypothyroidism? No.
You give medication, right?
Yeah. What type of medication?
That PMP I said, propyltyrosine, iodine.
No. Propylene. It's all these things are what we use for hyper.
Okay, for hyper.
Yeah, to suppress the thyroid. That is for hyper, which can cause hypo. They
Okay.
can cause hypo. Okay, so we give it to a patient with hyper, but eventually, because it suppresses the thyroid gland, it can lead to hypo. That was why we discussed it earlier. Does that make sense?
Yes.
All right. So, what medication do we give? We give a synthetic thyroid hormone replacement. Example: Have you heard of
Tyrosine.
eh?
Tyrosine.
Have you heard of Synthroid?
Yes, Synthroid. I've heard of Synthroid.
Okay. Yeah, Synthroid is a synthetic thyroid hormone. That is Synthroid. Synthetic thyroid is a replacement of thyroid hormone.
Okay.
Synthroid should be given early in the morning, at least 30 minutes or 1 hour before breakfast. That is when it can be absorbed very well. If you check, if you or observe well, you will see that they give it only in the morning, first thing in the morning, first thing before people eat. So yeah, it's not the time it's not when the patient brings food or when the patient is eating that you bring Synthroid. No. I know some of my patients will not like it because that's why that's one of the reasons I wake them up in the morning when they're still sleeping to take their Synthroid. Yeah.
Okay.
Yeah. So and then do we give them high amount of calorie or low calorie diet?
Hi.
Why?
Because they need it for
They don't need it.
they don't need okay.
Because they have too much. They are adding weight. They're adding weight. We are talking about hypo. They're adding weight.
They don't need it.
Yeah,
Okay.
so we give them low calorie diet in order to promote weight loss. Now, what do they have? Is it constipation or diarrhea for hypo?
I will have constipation.
So we make sure we give them a fiber diet in order to promote their bowel movement. Okay. Yeah. So but part of the nursing intervention will be to warm the environment, You need to warm the environment. You need to also tell them that it does not start working immediately. It will take up to 7 days to start working. Okay. And you
Mm-hmm.
give it early in the morning before food. Make sure you treat constipation. If you are giving them any sedatives, you are very careful. Why? Why should you be careful when not giving them sedatives?
Hypo.
Why is it a big deal?
Mm-hmm. Should be careful when getting sedative for hypo.
Can you give me a second? I don't know. This person has been calling me since.
Okay, go ahead, sir.
Hello. Sorry, it's all these people that are spamming, they are giving people call. Yeah, asking me, am I talking with Mr. Steve? I said no. He said, who are you? I said, who are you? All right. So yeah. So that is why you need to be careful when okay, did we talk about why you need to be careful when giving sedatives?
No, that's what you asked me.
Okay, yeah, answer.
So I'm trying to think.
Now, what happens to them? Do they have insomnia or they are very weak and they're always sleeping? Which one do you think people patient with
They're
hypo?
where we can always sleep in.
Yeah, so when you're giving them sedative, they can become hyper sedated and it may
Mm.
be difficult to wake them up. So you need to be careful if they have to be given sedative or hypnotics for maybe some other reasons. Now, for hyper is also caused by an autoimmune condition. But this autoimmune condition, we call it, we call it Graves' disease. What did I say the autoimmune condition is called?
For hyper,
For hypo.
for hypo is Hashimoto.
Perfect. Perfect. Now, for hyper, the autoimmune condition is called what? Graves' disease.
Mm.
So, because sometimes NCLEX will not tell you hyper or hypo. They'll just tell you a patient has a Graves' disease. What are the symptoms? So you need to know that Graves is associated with what? With hyper, whereas Hashimoto's is associated with what? Hypo. Is that clear?
Yes, sir.
Yeah. Now, but so that is the most important cause. Another cause could be maybe some other yeah, maybe inflammation of the thyroid or something else. But most of the time, it is Graves' disease that causes hyper. In this case, the thyroid gland, the autoimmune condition, instead of it destroying the thyroid gland, is making it to produce excessive thyroid hormone. Okay? And when it becomes excessive, remember the function of the thyroid hormone. Now, they become nervous because everything is hyper excited, nervous. There's insomnia, they are restless. Remember, the other ones are
Relax.
tired and weird and relaxed. I
Mm-hmm.
don't want to use the word relax because relax is positive. This one is excessive relaxation. They are tired, somnolent. But these ones, restless, insomnia, yeah, there's tachycardia. The other one has bradycardia. Okay. There's
Mm.
increased appetite for these patients. The other one will have what?
Um,
Loss of appetite.
Loss of appetite.
Yeah. Weight loss for this. The other one will be weight gain, right? Now,
Mm-hmm.
there is fine motor tremor. You know what a tremor is?
Mm-hmm.
Yeah,
firing.
why is it that? Why does it occur?
You have it for hyper.
Yeah, for hyper. Yeah, the muscles are contracting. So we also cause sweating and heat intolerance. The other ones had cold intolerance.
Mm-hmm.
They get cold so easily because the muscles are not contracting. But these ones, the muscles are contracting excessively, so they are generating too much of heat. So they can't even bear it. Even when it is cold, they start sweating because the muscles are always contracting.
Okay. Will you say hypo is obtunded?
Uh, yeah,
Okay.
yeah, yeah. So there's muscle wasting. You know what muscle wasting is?
I explain. I know it, but muscle wasting is mostly for Cushing disease, right? Cushing.
Muscle wasting occurs in many conditions. Kwashiorkor, when you are not, when the muscles are overused, they are not getting enough energy. What happens? You start breaking down your muscles to generate energy. So you lose your muscles. Okay.
Okay.
Yeah. Now, complications are what we call thyroid storm. Thyroid storm is when it is excessively high. So when there's thyroid storm, the patient ends up having what we call exophthalmos. You see their eyes.
Mm-hmm. Budding.
It bulges, the eyelid does not close. So you can imagine when they want to sleep and their eyes are open. Can they sleep with their eyes open? So one of your nursing responsibility is to tape their eyes so that they can sleep, or also give them a shield to cover their eyes. Okay? Yeah. So
They also need artificial tears.
yeah, they need artificial tears. We'll get to that. Yeah, they need artificial tears because it can cause laceration of the cornea. Perfect. So they can lead to hypertension, tachycardia, heart failure. Their temperatures are always high. They can have seizures because their muscles are always contracted, so that can cause seizures. Coma. Okay, and then eventually, one of the treatment is what? To remove the thyroid gland. When the thyroid gland is inflamed and is producing too much of thyroid hormone, one of the treatment is thyroidectomy.
Thyroidectomy.
So when they remove the thyroid gland, sometimes they make a mistake. Well, because most times, well, not most times, but sometimes they also remove the parathyroid gland because the parathyroid gland is connected to the thyroid gland.
Mm-hmm.
So when the parathyroid gland is removed, what do you suspect the patient may also have, apart from, yeah, what else will you?
They'll have low calcium.
Perfect. Perfect. So while you are managing this patient for thyroidectomy, we are managing the thyroid hormone, replacing thyroid. Always look for signs of calcium deficiency.
Okay, even for thyroidectomy, right?
Yeah, thyroidectomy is just like when they chase the mother away from the house, the daughter follows it.
Okay.
So even though it's the mother that is, the daughter did not do anything, but the two of them follow. So while you are still trying to settle the thyroid hormone, you also watch out for the parathyroid.
Mm-hmm.
And one of the manifestation is calcium deficiency. Okay. So
Mm-hmm.
treatment is from surgery. We do thyroidectomy, or sometimes we can give them radioactive iodine. Radioactive iodine we use it to destroy the thyroid cells, which is why it can result to what? Hypo.
Mm-hmm.
Can result to hypo. Okay. Or we can give them many other medication that will really decrease the synthesis of thyroid, such as what?
You say that will reduce the synthesis of thyroid?
Thyroid hormone, yeah. Example, you do did you hear propitouracil?
Okay, that reduce the synthesis. Okay, yes,
Yeah. What
I
again? Iodine.
meant vitamins.
Metimazole. Perfect.
So,
Hello. Hello. All right. So we've talked about this. So nursing interventions include to decrease the environmental stressors because they're always very agitated. They are restless. So you don't want to increase noise or light. You just want everywhere to be calm so that they can be calm a little bit and sleep. So which will you provide cool environment or hot environment for this patient?
for hyperthyroidism, school environment,
Yeah, hypo.
warm environment.
Perfect. Perfect. You are sleepy. You are
No,
tired.
I'm not. I was before I joined. We joined together.
Yeah.
I've been on questions, so
Oh,
I've been
okay.
it. So
Okay. So yeah, you give them balanced diet because they need a lot of food because they are losing weight. They need energy. Artificial tears, like you mentioned earlier, should be provided. Yeah,
then
because
their
if
eyes has to be lubricated as a result of dryness of the cornea.
yeah, you have to give artificial tears. You have to patch the eyes before they sleep, okay? Or
Mhm.
tape their eyelid, remove all the lights to reduce excitation. Now, you need to maintain after surgery, if the patient undergoes thyroidectomy,
Mhm.
you need to assess the surgical site so that it does not bleed. And if it's bleeding, because the patient is always like this, the bleed may not even soak the dressing. It may trickle down to the side. So when you're assessing, don't just assess the dressing alone, also assess the side of the neck and
Yes,
the back. I don't know if you're getting what I'm trying to say.
yes, sir. I
Yeah,
understand.
because blood can be pooling at the back, and you would think you look at the dressing, oh, it's dry, it's clean. It's not true. So you need to assess it thoroughly. Then you administer analgesic for pain. Give them IV fluid initially. Don't give oral. Why should you avoid oral initially?
Because what you are doing is dealing with the neck, the larynx, pharynx, and everything. So you should avoid. They are tender at that time. So you give them time to heal. So you avoid anything oral.
Well, avoid anything oral because you want to monitor them. You don't want them to choke. You don't want them to choke.
Mm-hmm.
They're just coming from surgery. They're coming from, and then they may also be having some laryngeal spasm. So you don't want to give oral until you do thorough assessment. Then
You have to wait for them to regain their
their
reflex.
consciousness, yeah, gag reflex. So evaluate for calcium, check if they have tetany, and then evaluate them for thyroid storm and make sure that things are returning normal. And after the thyroidectomy, you have to start giving them what? Synthroid on daily basis.
Yes.
On daily basis. So yeah. So you need to assess them because when they start having noisy breathing and become restless, then you need to monitor because they may be having laryngeal spasm. And when they have laryngeal spasm, if it's not handled, they will not breathe again, and that can result to death. So you make sure you have tracheostomy tube ready. Make sure you have tracheostomy tube ready.
Mm-hmm.
Okay. Yeah, tracheostomy tube. Make sure you have it ready. And then, yeah. So now let us look at these questions.
Obtained. Oh, no. Decreasing the production of thyroid hormone, yes. B, replacing deficient thyroid hormone, no. The answer is B.
Okay. A patient with hyper is prescribed metimazole. The nurse knows that this medication works by decreasing the production of thyroid. Perfect. Perfect. That's what we just described now, right?
Mhm.
What about this?
The patient with hypothyroidism is likely to present with which of the following symptoms? Hypothyroidism.
Mhm.
Hypo is weight gain. It's bradycardia. Heat intolerance. No, it's cold intolerance. The answer is fatigue.
Okay, patient with hypo. Wait, okay. Heat intolerance. Okay, perfect. Perfect. Okay.
A 60-year-old female patient with hypothyroidism is prescribed
Levothyroxine is also synthroid. That's what we call, even in Nigeria, we call levothyroxine. But it's called synthroid too. So go ahead.
and is used for hypothyroidism, right? Okay. It's prescribed. Which of the following instructions should the nurse include when teaching the patient about taking this medication? Okay, told me about central. Take medication with food to minimize gas. No, you said it has to be taken before food early morning. Take medication at bedtime with a glass of milk. Take medication in the morning on an empty stomach. Take medication with a capsule. The answer is C.
Perfect. Ordinarily, if I didn't tell you, you may not answer this question
Oh,
correctly.
no, 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 no.
Yeah, yeah,
I didn't
because
know levothyroxine is same thing as
it's
central.
same thing as Centroid. Yeah, it's the same thing. Is the trade name. Centroid is the trade name. Okay. Now, what about this? Select all that applies. You like it?
Yes,
Okay.
yes. I'm sure what failed me was a engine.
NGN is.
We will do NGN together. I'm always scared
Yeah,
of
yeah.
it.
I want us to build content first.
Okay.
Yeah, let's build content and
Yeah.
then we do NG. Yeah. Okay.
The nurse is assessing a patient with newly diagnosed Graves' disease, which
You
is
see what I told you before? Did you
hyper,
put maybe hypo? Okay.
with newly diagnosed Graves' disease. Which of the following symptoms would the nurse expect to find in hyperthyroidism? Exothalamus is there.
Mhm.
There's no bradycardia. There's no weight loss. Hold on. There's weight loss.
Okay.
Exothalamus is there. There's weight loss. There's no cold intolerance. There's heat intolerance.
So what's the answer?
Exothalamus,
Mhm.
weight loss, heat intolerance.
That's ACE. Perfect. 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 Now, let's see this.
A nurse is providing discharge teaching to a patient who has undergone a thyroidectomy, that is, removal of the thyroid. Which of the following instructions should the nurse include? Avoid all physical activity for 6 weeks. You will not need to take thyroid medication after the surgery. Monitor for signs of hypocalcemia, such as tingling around the mouth. Apply it to the neck to reduce swelling. We talked about monitoring for signs of calcium, of tetany. Tetany is low calcium, which is hypocalcemia. So I will hold on to C. Avoid all
Okay.
physical activity for 6 weeks. 6 weeks is too much. You will not need to take thyroid medication after the surgery. That's not true. Apply heat. You cannot apply heat. So the answer is between A and C, but I'll choose C.
Now, the answer is C. But
Mhm.
did you see how A has all?
Okay, all is true.
You can't say avoid all. See where the surgery is. Not on your hand. The patient can still
Yeah,
be doing range of motion exercise.
it's
Can still,
true.
yeah. So A is out of it. Did you understand?
Yes.
Yeah. And look at all those absolute statements. Be careful with them because, yeah. Okay. I think this is the last before we move to another topic. If for the, yeah, this patient has hyperthyroidism.
Thyroid is not coming. Monitor for monitor for hypocalcemia. Symptoms tetany. Okay. A 45-year-old male patient is diagnosed with hyperthyroidism. Which of the following symptoms would a nurse expect to find during the assessment? During the assessment, you have weight loss, you have tachycardia, A and B is not there. You have the answer is heat intolerance.
Hyper, body weight. That's correct. So you are getting the concept. So now let's go to parathyroid. Parathyroid, you already know it. It's not a big deal. Um, um, you know, it's when there's reduction in the parathyroid hormone levels. So, and now in next gen class, you don't necessarily need to memorize some of these values because they'll give you range. They'll give you range. So it can be caused by so many things. Now, remember, calcium is there, right?
Yes.
Phosphorus is there. Parathyroid hormone is there.
Mm.
Okay. So it can also be caused by kidney disease. Why? Sorry, this is hyperparathyroidism. So yeah, hyper means high amount of parathyroid hormone. The first one is enlargement of the thyroid parathyroid gland. Maybe due to anything that will cause maybe a tumor that will make it to enlarge and it start producing too much of parathyroid hormone. Okay. Now, why is kidney disease a factor?
In hyperparathyroidism.
Yes.
Mm.
When there's kidney disease, what happens to your calcium level?
When there's kidney disease, calcium level is released, is high.
No, calcium is released from where?
Eh, okay, it's low. I don't know.
Yeah, because the kidneys are not producing vitamin
It's
D.
not well.
So, yeah. So when it's high, normally when calcium level is high, how does the body react to raise the level of calcium in your blood? By producing what? Parathyroid hormone.
Okay.
When parathyroid hormone is produced, where does it go to? I told you it does three things. Remember yesterday? It does three things. One,
Yeah.
it absorbs calcium from the bone into the blood. Because you know the bone stores calcium. It's just like you saved your money under your pillow,
Mm-hmm.
and you have some that you are still using. You are using. When that one finishes, what happens? What do you go? You go to your pillow and take some, right? So the body has saved calcium in the bones. That's the natural reservoir for calcium and other nutrients. But when there's no more calcium in the blood, the body will produce parathyroid hormone. Parathyroid hormone will now go and do what? And withdraw those calcium that it has saved in the bones and bring it back to the blood.
Mm-hmm.
Number two is going to tell the kidneys not to absorb, not to tell the kidney not to waste calcium, right? So that the kidneys can absorb calcium. Number three, to tell the kidneys to synthesize vitamin D so that you can absorb calcium from where? From the intestine. So all these things will now raise the level of calcium in your blood. Remember, it was caused by low calcium level originally. Okay.
Mm-hmm.
So when there's low calcium level, the body will react to it excessively and then produce high amount of parathyroid hormone in order to counteract it. So these are causes of parathyroid, hyperparathyroidism symptoms. Now, like I told you, that you withdraw when there's hyper, you withdraw too much of calcium from the blood, from the bones into the blood, right?
Mm-hmm.
Now, this is your bone. Well, not your own, no, but this is somebody's bone, and this is blood vessels. So when there's low calcium in the blood vessels, the parathyroid hormone is released so that calcium will go into the blood vessels, right?
Mm-hmm.
Now, what happens to the bone when all the calcium leaves the bone and go to the blood vessels? What happens to the bone?
It becomes brittle.
Brittle, fragile, and it will become painful and can break easily. It can even result in osteomalacia or osteoporosis. Now, kidney stones are also another problem. Remember, yesterday we did a question that talked about kidney stones when a patient has hyperparathyroidism. Do you want me to go back to that question?
No.
Okay. So now, why are they prone to kidney stones? When I talked about calcium, forming stones, when there's too much of calcium in the blood, it can form stones in the kidneys, causing renal stones, right? Yeah. Now, polyuria and polydipsia are also present because the body will want to, by all means, take away all the calcium in the blood. Muscle weakness, fatigue, and depression. These are common symptoms of hyper. This is not hypo, sorry. I don't know if I made a mistake. This is hyper. Hyper, not hypo. Okay? Yeah. Now, how do you manage it? By giving them medications that will supply calcium so that the body does not have to withdraw calcium from the bones. Vitamin D supplement if it's deficient, and then you give them, medication that will strengthen their bones and things like that.
You said you asked a question. So why does the kidney form kidney stones?
Yeah.
That's what you asked just now. So I think kidney form kidney stones because one, the kidney can no longer function properly, and then don't have enough water in the system that can flush through the stones. So we have to take enough water. What's the answer? I don't know.
No. It's because calcium is too much in the blood.
Okay.
So I told you when calcium is too much, they start coming together. And when they come together, what happens? They form stones.
Oh.
Yeah, that is why. Yeah. Okay. Nursing management is to monitor their calcium and phosphorus level. Remember, calcium and phosphorus are cat and rat.
Opposite.
Yeah, you monitor them for signs of tingling, muscle spasm, and Chivostek sign. What does Chivostek sign mean?
When you stroke the cheek,
Okay.
when you stroke it, I
It's
think
contract.
contracts. Okay.
No, that is yeah, that is Chivostek sign. This is Trussios sign, the one we use blood pressure.
When you use blood pressure,
Yeah, yeah, yeah.
it's will be like
So
this.
you monitor this, I call it weight-bearing exercises. When you do weight-bearing exercises, the bones become stronger. They'll be storing more calcium because they need calcium to become strong. And then, yeah. So hypo is basically caused by maybe removal of the hyperthyroidism. For example, when a patient is having hyperthyroidism and you remove the thyroid gland, what happens? You may mistakenly also remove what? The parathyroid gland. So that will result in hypo. Autoimmune destruction, or when there's radiation, if a patient has head and neck cancer and you put radiation on the neck, it can also destroy the parathyroid gland. So all this can cause hypo.
Okay, hold on. What then causes hyper? Remind me.
Hyper is caused by deficiency of vitamin D or low calcium levels in the blood. So in order for the body to counteract that, it produces high amounts of parathyroid hormone so that the blood can get calcium from the bones.
Okay.
Yeah. So symptoms are tetany. So always remember tetany is associated with what? Low calcium levels. Paresthesia, low calcium. Seizure, low calcium. Cardiac arrhythmias, low calcium. And broncho or laryngeal spasm, low calcium. This is why after thyroid surgery, you don't give oral fluid because if the patient has hypothyroidism, it can result in laryngeal spasm.
When you say somebody is having spasm, can you explain?
Spasm is when your body is contracting, when your muscles are contracting, or everywhere is shaking. That's spasm.
Okay.
Okay. Now, management is to give them calcium supplement to vitamin D, and then can also give replacement of the parathyroid hormone, which is what we call the recombinant parathyroid hormone. In the US here, we call it NADPARA. That is when it is severe.
Mhm.
Okay. Now, nursing management is just to monitor for signs of hypocalcemia. You educate them on the importance of taking their calcium supplement and vitamin D supplement. Avoid food that are high in phosphorus. Why should they avoid food that are high in phosphorus?
For hypothyroidism.
Yeah.
No, because it's calcium they need, not phosphorus.
Yeah. What happens when they take food that are high in phosphorus?
Mm, phosphate.
So,
Mm,
so if they eat food that are high in phosphorus and their phosphorus goes high in the blood, what happens to their calcium level?
I think it
Remember,
is
calcium and phosphorus or phosphate. Phosphorus and phosphate, they are the same. Remember, calcium and phosphorus, they are opposite.
opposite. Okay.
So if phosphorus is now high in the blood, what happens to calcium level? Calcium level drops.
It drops.
So and that can result to hypocalcemia, and you don't want that.
And already
Okay.
there's hypocalcemia.
Yeah, there's hypocalcemia. So yeah, you don't want that. So you've gotten this crucial sign and Chivostek sign. You got it perfectly well. So I've not wasted your time on this. Now, the nurse is educating a patient who has hypothyroidism. Which statement by the patient indicates a need for further instruction? Now, when you see a need for further instruction, what does it mean?
You need for further teaching.
Yeah, or
That's
further teaching or further, yeah.
something that the person is saying or is doing that is wrong.
Yes, that is wrong. So it does not mean it is the right answer because this
Yes.
can be, it's not, it's the wrong answer you would choose. So
Mm.
if the patient says, I will take my calcium supplement as prescribed, does it need further instruction or further teaching?
And also educating a patient with hypoparathyroidism. This is whereby the patient gets a need for further teaching. I will take my calcium supplement as prescribed. It doesn't need further teaching.
Okay, what about I need to avoid food high in phosphorus?
You just said it just now.
So
Hypothyroid.
does it need further teaching or not?
Hold on. We need to avoid food high in phosphorus. Hypothyroidism needs food high in calcium.
Mm-hmm.
I'm just confused again now. You need to avoid food high in phosphorus. It's correct. It doesn't need for
Okay.
that.
Okay. I should drink plenty of fluids to prevent kidney stones.
It doesn't need for that teaching.
I should report any muscle cramps or tingling to my doctor.
It doesn't need for that teaching.
So which one is further teaching?
Okay, let me look at it again. I will take my calcium supplement as prescribed. That's good. I need to avoid food high in phosphorus. I should drink also. Mhm. It's B, but let me understand why it is B, which is whereby the patient indicates a need for further teaching. I need to avoid food high in phosphorus. So with hypothyroidism, they need food high in calcium. So uh, it's B, but can you explain to me again why it is B? Because every other answer is correct.
Okay. The answer is not B, the answer is C.
Is C
Mm-hmm.
to prevent kidney stones?
Are they
But
at risk for kidney stones?
are there what?
At risk for kidney stones? Now,
No,
they have hypothyroidism. What happens to their calcium level?
it's low.
So is there a risk factor for
There's
kidney
no
stone?
links. Oh,
So,
Jesus.
so this is the answer.
There's no risk for kidney stone, you see?
Mhm. The answer is C. You clarify them. You don't need to, yeah, you are not at risk for kidney stones because your calcium level is even low.
Yes, and it's too much calcium that causes that kidney stone.
Yeah, yes.
Mm,
Okay.
yes, sir.
All right, now do this.
I'm sure this was how I failed. A patient with hypothyroidism is expressing tetany, that's low calcium. Which of the following interventions should the nurse implement first? First thing, administer calcium gluconate intravenously. Provide a high calcium diet. Tetany. The calcium diet. Apply one compress to the affected area. Encourage deep breathing exercise. Hmm. Ah,
It's getting tougher, right?
it's expensive to plan. Which of the following should the nurse implement first? Okay, so as a result of the low calcium, eh,
Mhm.
encourage deep breathing exercises because the calcium is low, it might start having some like chest problem or so. How will I say it now?
Now,
Yeah,
look at this question. They said which one should you implement first, which means everything or even most of it may be correct.
yes, A and B is correct.
But which one do you do first? Which one? That's the major thing here.
Okay, what I will do first is A.
That's the answer. That's the
Yeah,
answer. Because everything you are doing, you are just managing the symptom. You are not treating the problem. Okay? The encouraging deep breathing exercise. Deep breathing exercise is caused by what? Low calcium. The problem with breathing is caused by low calcium. Warm compress does not really have any issue. Provide high calcium diet. High calcium diet is okay, but it will not be as fast as when you give IV.
yeah. But do you do breathing exercise for low calcium?
Now, low calcium can have tetany, right?
Mm-hmm.
So muscles will contract. That's what tetany is. There's contraction of muscles. So,
Mm-hmm.
the trachea also has muscles. So it can also contract too and make sure and to prevent the patient from breathing well.
Mm-hmm.
You understand? So that can predispose the patient to laryngeal spasm or poor respiratory. So you can do deep breathing exercise to expand the lungs, but it is not the priority because the calcium level is still low. So exercise cannot stop it.
Okay, do you know why I chose D? I chose D because when you see questions that say first, it's something you will do and you will do something else again. But when
Yeah, but you need to be careful. Don't That's why it's not a 100% rule.
okay.
Why you are saying because they say you do ABCD, you attack ABCD, ABCD. That
Mm,
is in emergency situation, but this one is because all these things are caused by low calcium level.
okay.
So once you give IV, it's going to return the calcium level, high to a normal range.
Okay.
Now,
One thing I have to remember, sorry, you say low calcium causes contraction, right?
yeah, causing contraction, yes. Low calcium causing contraction. Because it allows the influx of sodium into the cell. That one is a different uh, explanation.
Okay.
All right, which symptom would you not expect to find in a patient with hyperparathyroidism?
Hyper, hyperparathyroidism. Chigosic is low calcium. Transia is low calcium. Hyper.
Hmm.
Seizures, bone pain. Of course, there is bone pain in seizures. Hyperparathyroidism. Seizures.
Okay. You know, A is not correct, right?
Mm-hmm.
What is A? Chivostic sign. What does it mean?
This
When
contraction
you
of the
when you stroke the foot, what happens?
it contracts.
It contracts, right?
Mm-hmm.
Is that contraction not seizure? Seizure is abnormal muscle contraction. It can be from one particular muscle. One muscle may be seizing, or it can be everywhere. So, um, yeah, so hyperthyroidism can cause it is caused by low calcium levels. Seizures are caused by low calcium levels. Now, what happens to your calcium level when there's hyperparathyroidism?
It's high.
So, what happened to the calcium in the bone? Remember, you kept your money under the bed, your savings, and you've finished spending the one you have in the hand, and you went and took all the money from your savings and start spending. While you have enough money in your hands that you are spending, what happens to the one under your pillow? It's empty, right? So most of the calcium that should be in the bone have gone to the blood vessels. So
Mm.
this can result in what? Bone pain.
Okay, let me understand.
Are you okay with A and B?
Yes, I will. Oh, and this not there.
Seizure. Okay, if you want me, let me go to
It says
let me go to
the
hypo.
mistake
You
is
see, can you
contraction.
see can you
Understand.
see this is hypo, right? Look at the screen.
Mm-hmm.
This is hypo. See one of the signs, one of the symptoms. What is this?
Seizure.
So seizure is for hypo. Now let's go hyper. Also, one of the signs is what?
Bone pain.
So what are they asking us now? Is it hyper or hypo?
Yes. So I just wanted to explain the way you explained that bone pain just now. I liked it. Can you say it again?
Okay.
So you said when the
When we
calcium.
when we eat calcium, it goes to the blood, but then we store it in the bones.
Okay.
We store it in the bones, and we keep some in the blood.
Okay.
But when we don't have enough in the blood, parathyroid hormone is released. When it is released, if it's released in excess, what happens? It tells us, okay, go to the bone and get all the calcium that you saved and bring them back to the blood.
Okay.
So when there's no calcium in the bone, what happens? The bone becomes empty
Okay.
and it causes bone pain.
Okay. It's okay.
Yeah.
Mm-hmm.
Yeah. Yeah. I know it can be confusing if you are not careful. It can be confusing, but you just have to maintain your ground. Don't allow yourself to be shaked. Yeah. Okay. Now, this is the next one we're gonna talk about. The adrenal gland. We talked about it yesterday. We
I don't
said
know. Neuro,
has medulla, yeah,
neuro,
endocrine.
is it neuroblastoma?
No, is it the one we talked about yesterday?
No, okay. Yeah, I'm just trying to remember something.
Yeah, pheochromocytoma.
Because I told
Yeah, pheochromocytoma is adrenal gland. Yeah, but that one is adrenal medulla.
okay.
The cortex produces three hormones. What are they?
The cortex produces glucocorticoid,
Mm-hmm.
aldosterone.
Mineralocorticoids.
Okay, same thing as mineralocorticoid.
Aldosterone is an example of mineralocorticoid.
Okay, mineralocorticoid and androgen.
And androgen. Perfect. Now, what is an example of glucocorticoid?
Corti corticosteroid.
Cortisol. Cortisol. Corticosteroid is the medication that we give. It's cortisol.
Cortisol.
Okay, cortisol. Yeah. And we talked about the function of cortisol yesterday.
For inflammation.
Inflammation, helps with glucose metabolism. It reduce, yeah. So now start imagining, and we also talked about the function of mineralocorticoids yesterday for retention of what?
Yes, salt and water. Reabsorption of salt
Salt,
and water.
yes, salt and water. But you know the salt is what?
Sodium.
Sodium. I don't want you to make mistake and call potassium salt.
No, you told me yesterday. I used to
Yeah,
call.
and you know the difference, the relationship between sodium and potassium. They are cat and rat.
Mhm.
So we are going to use that idea to understand what happens when there are too much of this thing. Now, this is all you've mentioning already, so I'm going to skip this. Now, these are the functions of the glucocorticoids or cortisol. We've talked about it already. Um, uh, let's start with when there is low adrenal function. When there's low adrenal function, we call it what? The Addison disease or Cushing's disease?
It's not this thing.
That's Addison's. And what happens in Addison's? All these hormones I've been talking about will be low.
Yes, cortisol and aldosterone.
Aldosterone will be low. So, what do you think will happen to their the blood level of their water?
It will be low
Why?
because I know everything is low.
It's not everything that is low.
Okay.
No.
I don't know that.
Now, what happens to aldosterone in this patient?
It will be low.
So when there is low, what happens to sodium?
Oh, it will increase.
Sodium will increase when there's no aldosterone.
No, you say okay, when aldosterone is low,
Yeah.
aldosterone has reabsorption of salt and water.
But when we don't have it, what happens?
There's no sodium, low sodium,
What about water?
low water,
No water. So what happens to the patient's weight?
low,
Low. What happens to the patient blood pressure?
low, because
Low.
salt and water goes together, low.
Yeah. What happens to patient blood glucose level?
It's still going to be low.
Low. What happens to the patient's potassium?
To be high.
Perfect. Perfect.
You see the way you related it now. Someone will not be
Yeah,
able to.
exactly. Yeah.
That's the problem.
Yeah. So remember, this is the one we talked about, hyperpigmentation. You talked about it earlier. You see, there's hyperpigmentation on their skin because of high amount of adrenocorticotropic hormone. Okay? High amount of adrenocorticotropic hormone, but then the adrenal glands are destroyed. So they have hyperpigmentation. They are also weak. What about how do they manage stress? They don't have stress hormone, so they have poor stress tolerance. Poor stress tolerance. Now, the opposite is what we call what the Cushing syndrome. Cushing syndrome is when everything is in excess.
Okay.
And it's mostly caused by a tumor well, it can be primary or it can be secondary. It can be a tumor in the brain that produces too much of adrenocorticotropic hormone, or it can be from cancers, causing what we call paraneoplastic syndrome. But you don't need to know this. The cancer will be making the patient to produce excess hormones. Or when you give somebody glucocorticoids for a long time, corticosteroids for a long time, it makes the patient to have too much of steroids, and that will result in Cushing's syndrome. Does that make sense?
Yes.
Now, what are the symptoms?
Mm.
Now, what happens to the patient's weight?
For Cushing, it's enlarged.
There's increased weight. What happens to the patient's sodium level?
Mm. It's increased.
Increase. What about what happens to the patient's potassium level?
It's reduced.
It's reduced. Now, there is also risk for osteoporosis. Remember, yesterday we said what is the side effect of prolonged use of corticosteroid? We said what? Osteoporosis. Can you remember that question yesterday?
Yeah.
Well,
Yeah.
yes, osteoporosis is one of the side effects of corticosteroids. So it is also a complication of Cushing's syndrome. They have moon round face, moon round face. This patient have moon round face. Okay, emotional disturbance. Now, what happens to their immunity? Will it be high or low?
No, it's low.
It's gonna be low. The same way when you give somebody corticosteroid for a long time, it suppresses immunity, right? So
Yeah.
this patient may not even have fever. They may not even, when they are having infection, they may not have fever because fever is caused by inflammation, and inflammation is suppressed here, right? So that is Cushing's. And most times what we do is to manage symptomatically, or if we have to remove the tumor that is causing that thing, we remove it. All right. Now, which of the following statements by a patient with Cushing syndrome indicates a need for that teaching? When we are done with this, we'll only do 2 hours. I think 4 hours would be a long time for us. To be too long, and I don't want us to get tired and not engaged. So, all right. Which
4
of the
hours.
following? I say 4 hours is a long time.
4 hours in a day.
Mm,
It's a long time.
it's a long time. It's a long time. Yeah, I think 2 hours should be fine. Yeah, and then I give you an assignment yesterday. You did not do the assignment today. I'm a teacher.
Do not
I'm a
remember.
teacher.
I'm sorry.
You know, I'm a teacher. We don't like that.
I'm sorry. I don't remember.
We don't like that. Nah.
Oh
Okay.
no.
All right. Now, which of the following statement indicates a need for further teaching?
For Cushing disease, which of the following statement by a patient with Cushing syndrome indicate the need for further teaching? Okay, I will need to take my medication exactly as prescribed. That's good. Should avoid people who are sick to prevent infection. I can eat as much salt as I want since my sodium level are low. That's how I see. I monitor my blood pressure regularly. Yes, you monitor your blood regularly. I can eat as much salt as I want since my sodium level are low. Sodium level is high. That's how I see.
Okay, that's correct.
But I should avoid people who are sick to prevent infection. Okay, that's
Yeah,
correct.
that's correct too. That's correct. Okay.
A patient with Addison disease is likely to present with which of the following? Hypertension, no. Hyperglycemia, no. Hyperpigmentation, no. Hey, this is tempting.
Remember. We just talked about it.
A patient with Addison disease. Okay, hold on. The answer is hyperpigmentation.
Correct.
Because how
Perfect.
did I know? I knew through hypothyroidism. That's how I knew.
Yeah.
So, and Addison is something that requires cortisol and Okay.
Yeah, yeah. Hyperpigmentation is the answer.
Yes.
Yeah, you're getting it also. Okay. Another one is there for you.
Hyperpigmentation. Because let me write hyperpigmentation.
Okay.
Hyperpigmentation. Bruised. Hyperpigmentation means that the skin is bruised, right?
No, skin is black.
Black.
Mm-hmm.
Okay. Too much of pigment.
Mm-hmm. Too much of pigment, yeah.
Okay. A 45-year-old female patient presents with central obesity, a round face, and a buffalo hump, which is Cushing. She also reports muscle weakness and frequent bruising. Hmm. Based on these symptoms, the nurse suspects Cushing syndrome. Which of the following findings would further support this diagnosis? Increased serum potassium level. No, sodium is high. Potassium should be low. Okay. Decrease serum glucose level. No, glucose is high. Elevated serum cortisol level. Oh, the answer is C.
Okay. No, that's correct.
Mhm.
Why is it not A?
Because potassium is low. Sodium is high.
What about glucose?
Glucose is high.
All right. So that's correct. That's correct. Now, this,
Oh, sorry. I thought I was waiting for you to talk.
no, 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 no.
Okay, a patient diagnosed with Cushing's syndrome is admitted to the hospital. Which of the following nursing interventions is most appropriate for managing this patient's condition? Is most appropriate for managing this patient's
Wow.
condition?
Most.
Cushing's syndrome, restricting fluid intake, monitoring blood glucose levels, encouraging high calories snack, administering potassium supplement. Hmm. See, a kind of look right, but the answer is it's most appropriate. Answer is B.
But you just got it correctly. D is also right in a way,
Mm.
but the answer is B. Perfect. Perfect. I like the way you are reasoning, you are thinking, because you are putting the pieces together. And that's what I want, and that's what will take you through NCLEX, because NCLEX comes with a lot of maybe this is also right, but you go for the most appropriate.
But I thought like this during the English. I did not
No, no,
pass.
I think fear was one of the major problem you had. And again, during the exam, you were so anxious.
Yeah,
You were so
NG my problem. It was a lot of engines, like full notes. I will read. I said, Jesus, why am I reading too much? And I hate to read too much. Read. That's too much.
and well, the NGN you can use it to answer more than 10, 5 questions, 6 questions.
Questions.
And some of them are just things that you already seen. Once you're reading the case study, you're already having a picture of what they are saying.
Okay.
NGNs are even the easiest to answer.
Yeah, when I'm practicing is the easiest, but when I went to the exam, that I don't know what happened.
Yeah, I think you and again before you attempt NGN, you need to have solid knowledge of the content. Because
Yes.
NGN is not a big deal. NGN is sometimes it may be the same thing we are asking you now, but they'll put scenarios. Okay, by 2 o'clock, the temperature was this. By 3 o'clock, the temperature has gone up, which means the patient is having fever. Yeah. So what are the things you'll be thinking about? So that is what NGN is. It's just making it to look real instead of just asking you, what is the difference between this and this? But they're putting it in a real life situation so that you would also have that imagination that you're taking care of a real life patient.
Mm-hmm.
That's the only difference. And maybe because when you see too many case scenarios, case study, you become so anxious. Hey, this is too much. I can't finish it. It's not true. It's just simple questions that they're asking, but they're making it look big.
Yeah.
For example, I'm asking you this question. A patient diagnosed with Cushing syndrome is admitted to the hospital. By 3 o'clock, the patient starts having retaining fluid and increased body weight and blood pressure is high. At 3 o'clock, at 4 o'clock, you check the blood sugar level. Blood sugar level is increased from let's say from 150 to 172. And then
Mm-hmm.
things like that. Now, what will be the most appropriate thing to do for this patient? Now, you know that the problem now is blood sugar level or having issues. So you continue to monitor the blood sugar level. Yeah. So it's just like this. But they will put in a lot of stories. But we have, when we get there, when we are doing practice questions, we'll start doing, but we need content because I don't want us to be going back and forth and some things that are very strange to you. Because if they're strange to you, there's no magic except to just do, 50-50.
Mm-hmm.
Yeah. So now, this should be easy. The nurse
You
is
know,
educating a patient diagnosed with Cushing syndrome about potential complications. Which of the following should the nurse include in the teaching?
the teaching.
Yeah, you first underline the word Cushing syndrome and then outline
Complications.
complications or potential complications. And then which of the following complications should be included in the teaching? Complications should the
Symptom of
nurse include.
Cushing syndrome.
Mm-hmm.
Okay. Um, mm, Hypertension is there.
Mm-hmm.
Diabetes mellitus is there.
Mm-hmm.
I will also say osteoporosis.
Okay.
That's all.
Okay, osteoporosis, hypertension, diabetes mellitus, and that is it.
Yeah.
That is it. That is it. That is it. This is a patient with Addison's disease. Which of the following instructions should the nurse include? Increase potassium intake for Addison's.
The patient with Addison's disease is being discharged.
Mm-hmm.
Which of the following discharge instructions should the nurse include? Increase potassium intake. Yes, hold on. Yes. Increase potassium intake. Yes. Wear a medical alert brace. Yes. Yes.
Now, before you start doing yes, this patient has Addison's disease.
Mm-hmm.
So normally, Addison's disease, what happens to the potassium level?
Is low.
For Addison's,
Oh, okay. You told me it's not everything that is low.
yeah, potassium is not low in Addison's. What is sodium low in Addison's?
Yes.
So when sodium is low, what happens to potassium?
It's high.
So do
Okay.
you want them to increase potassium intake?
Let me write it. You see, as you're teaching me now, I also used to think that everything is low in Addison.
No, potassium is not. No, okay, quite all right. If everything is low, but you also know that sodium and potassium are opposite.
Yes,
So if potassium is low, what happens to sodium?
it's high.
It's high. But in that sense, do they have high sodium? No, they have low sodium. So they will have high potassium level.
Okay. Okay, which
Okay?
of should the nurse include? Increase potassium level. No, you cannot increase potassium level. Sodium. In Addison, sodium is high. Potassium is low. So you increase potassium level.
No, ma. Addison's potassium is high, sodium is low.
Oh, Jesus, oh my confused. The sodium that is low. Sorry, I was supposed to say the opposite. Sodium is low, potassium is high. So that answer of increasing potassium intake is wrong.
Mm.
Then you wear a medical alert bracelet. I think it's correct. It's correct because everything is low, and the patient you know is on needs to be monitored. I don't know. Then see, avoid salt substitutes. Potassium is low. You cannot avoid salt substitutes. You need salt.
Okay.
Okay. Then discontinue medication when symptoms improve. No, I think it's for life.
Okay.
So the answer is B.
Perfect. 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 Now, if you were anxious, you would have gone for A.
Yeah, because I did not
And,
know
and
about
you
it.
say, oh, I knew it, I wrote the right thing, I did the right thing. But because of anxiety, the wrong thing now looks right to you.
Yes.
So that's why always ask yourself, am I doing the right thing? Are these things involves low cortisol, involves low aldosterone. Now, which of them, by the way, I did not mention that, which of them will have hair on their chest for females and their facial hair? They will have hair everywhere. Is it Addison's or Cushing's?
Pushing.
Why? Because of um because of androgen.
Androgen. Yes,
Yeah,
androgen.
because of high androgen. It does not affect males because male normally will produce androgen from their testes. So, but for women, they don't produce androgen normally or in a high level. But with Addison, with Cushing's, they start producing androgen in excess. So that can cause abnormal hair. Which other condition can make a female, have huge hair on their faces and their chests? Which other condition?
Mm. Mhm.
Polycystic ovarian syndrome, PCOS.
Mm.
Yeah, PCOS can cause PCOS will affect their aldosterone level, will also make them to have hyperglycemia or diabetes. And you see them, they are always big. Yeah, ovarian cyst. If it's multiple cyst, that's what we call it, polycystic ovarian syndrome, multiple cyst. Now, the next thing is diabetes. Diabetes mellitus. Yeah. Are you good to go? Can we continue?
Yes, sir.
All right. You spoke really well about diabetes yesterday
Mhm.
during the course of your answering questions. So you should know the difference between type 1 and type 2. What are those differences?
Type 1 is juvenile diabetes, mostly for children, and they
Okay.
lack insulin, and they are DKA, which means they are dehydrated. They have ketosis, ketosis. They have ketones. That's ketones. They
Mm-hmm.
have um, they have high potassium.
Mm-hmm.
They have fruity acetone, fruity breads.
Mm-hmm.
They have Kusma respiration.
Okay.
They have what else? Acidosis.
Yeah, they have acidosis. Now, all those things
Okay.
you're mentioning are just complications.
Okay.
Yeah. But type 2, what is type 2? Do they have all those things you're mentioning?
They don't have it. What they have is dehydration, and they are obese. So, and it's mostly as a result of too much eating.
Not too much. Most times it's because of obesity.
Obesity.
So because of obesity, their body is now less sensitive to insulin. But
Yeah.
they have insulin, or some of them have insulin, but insulin is not functioning
Yes.
because their bodies are less sensitive to it. That is
Mm.
type 2. I'm gonna skip this latent one, or the one we call type 1.5, because NCLEX does not ask about it. NCLEX only asks 1, 2, and then gestational diabetes.
Mm. It's my first time of seeing that, hearing that said.
Yeah. There's type 1.5.
Mm.
And then there's also what we call pre-diabetes. Pre-diabetes means the patient is becoming diabetic, but they are not yet diabetic based on the range, but their sugar level is high, but they've not reached. It's just like
It
you are going to your neighbor's house. You have left your house, but you've not reached your neighbor's house.
uh-huh.
Yeah, yeah. So now,
Gestational diabetes
gestational diabetes is for uh, pregnant women.
as a result of excessive eating,
Not
right?
excessive eating. It's a problem that the pancreas will produce what we call human placental lactogen, HPL. Human placental lactogen is an enzyme. It's a hormone that degrades insulin. It breaks down insulin, and insulin will become useless. It's the
Mm.
placenta that produces it. But after the patient has given birth and they removed all the placenta, the patient's sugar level comes back to normal.
Okay.
But these patients too are at increased risk for type 2 diabetes later on in life.
Okay.
Yeah. So we described this yesterday. After eating your food, I'm sure you ate today. You've not been hungry since 3 days. Your sugar level goes high. Your beta cells produces insulin. Insulin is pushed to your body cells where they are needed, right? No, glucose is pushed by insulin to your body sites where they are needed. The excess is stored where? In the liver as what?
Glycogen.
As glycogen. And then when this happens, it returns your blood sugar level back to normal, right? But yesterday that you did not eat in the morning, your sugar level dropped, okay? When your sugar level dropped, what happened? The alpha cells of your pancreas, the beta cell was the one that produced insulin, but the alpha cell will produce what? Glucagon. Now, what will
Mm-hmm.
glucagon do? Glucagon will go straight to the liver and break down this glycogen into what? Into glucose, and put it back to the blood vessels and raise it up. Does that make sense?
Yes, sir.
All right. So for type 1, is less than 5 to 10% of all diabetes cases. It's not as common as type 2.
Mm-hmm.
Okay. And there's absolute lack of insulin. They don't produce insulin due to an autoimmune destruction of the pancreas cells. So when the pancreas are dead, there is absolute lack of insulin. And that will make them, remember what I told you about the role of insulin. Insulin prevents the breakdown of fats from our body. But because these people do not have insulin, there's increased breakdown of fats. What is the end product of fat breakdown? Ketones. Ketones. And that's why patients with type 1, they're at risk for what? Ketoacidosis.
Mm.
Okay?
Yeah.
For risk factors, it occurs in patients less than 30 years of age, but it can occur in any age too. That's why we no longer call it juvenile. We just say it's type 1.
Mm.
Family history, genetic problem that will destroy the beta cells, and infection that will trigger immune reaction that will destroy the beta cells. These are the risk factors that make a patient prone to type 1 diabetes. Does that make sense?
Yes, sir.
Now, I'm going to skip this. Characteristics, it can occur at any age, but usually younger than 30 years old.
Mm-hmm.
Okay? At diagnosis, they're usually thin. You know why they're thin?
No.
Lipolysis has taken place. I told you insulin prevents lipolysis, breakdown of fat. But these people do not have insulin. What happens? Their fats are broken down, so they are always thin.
Okay.
Yeah, and they do not produce endogenous insulin. Like their body does not produce insulin. So they are going to depend on exogenous, the one we give them subcute in order to live. And they are prone to ketoacidosis. Okay. And complication is diabetes ketoacidosis. That's for type 1. Type 1 is just absolute lack of insulin due to destruction of the beta cells. Now, for type 2 constitutes more than 90 to 95%, which is more common. This is the most common one. Okay, and patients, up to 80% of these patients have obesity. So, which means at diagnosis, their body size is bigger than those in type 1 diabetes. Okay, yeah. And in this case, they may have normal insulin level, or they may even have high level of insulin, but that insulin is useless. It's just like if you have too much of old Naira notes, you have the plenty. Even though you have Naira, it's useless.
Yes.
Yeah. Yeah, because the country has gone bigger and they've changed yeah. So that is that is type 2 diabetes. It occurs in people younger than 30 years, older than 30 years. They can occur in anybody. Children are having obesity now, so they have started to have type 2 diabetes. Yeah, people with dyslipidemia, um, um, African Americans are at high risk. African Americans are at high risk. Those with BMI of over 30 are also at high risk.
Normal BMI is I think
Normal
20.
BMI is 18 to 24 points. Yeah, 24.9. Yeah. Yeah. So patients with previous history of gestational diabetes, they're at risk. Hypertension, they're also at risk. So do they have ketoacidosis?
For
Type 2?
no.
Why?
You explained it just now.
Mhm.
Because I cannot repeat what you said, but I have it in mind. So it's because I can't explain it. I can picture what is
They have insulin, right?
yeah, yes.
They have insulin just like the old Naira note. But that insulin is not working. It's not that it's not working. The body does not recognize it because the body is already big, So that insulin will prevent the breakdown of fats. That's why they are always big, the breakdown of fats. And it is the breakdown of fats that usually causes ketones. The end product of fat breakdown is ketones.
Okay, very simple the way you
So
said.
they are not at risk for ketoacidosis. Okay. Now, a client. Okay.
Do you mind me just write something?
Yeah, yeah.
The breakdown of fat. Okay, so they have incidence of the breakdown of fat. And then what was the other? And because of that, and then insulin. Insulin causes ketoacidosis. How did you say the last one?
Yeah, insulin normally would prevent the breakdown of fat.
Okay. Yes. Okay. So do you mind me ask this question?
Yeah.
concerning me. So, when I came into the US to give birth to my child, then I have not come here to stay to give birth to my child. So now I want to know what happened. They checked my blood. Then I didn't know anything about nursing.
Yeah.
They checked my blood because I don't know what the figure is, whatever. So they were not sure of something. I was pregnant too. So they now gave me a juice that is so sweet.
Sweet. Yeah, we have it here.
Then again, I say, man, why did they give me sweet juice when someone should be avoiding sugar?
Yeah, yeah.
Can you tell me why?
Yes. Okay. Even though we are skipping, but this is what is called oral glucose tolerance test. That is, it's a diagnostic test to know those who have gestational diabetes.
Okay.
So what we do is we give them concentrated glucose to drink. And after 1 to 2 hours, we check their sugar level.
Mm-hmm.
Normally, if you eat something that is sugary, after
Mm-hmm.
1 hour, what do you expect to happen to your insulin level?
It will it will reduce.
No, like if I take something that has sugar now,
Uh-huh.
and you have sugar, your sugar level goes up in the blood, what happens to your insulin level at that time? Now, after you eat,
Mm-hmm.
the glucose goes into your blood, raise your blood sugar level. What happens next?
The insulin starts to work.
Exactly, insulin is produced.
Mm-hmm.
And when insulin is produced, what does it do? It pushes the sugar away from
To
the
the
blood into
cells.
the cells.
Mm-hmm.
Now, what happens after you eat that high sugar level?
Mm-hmm.
And after 1 hour or 2 hours, your sugar level is still high, which
Mm-hmm.
means your insulin is not working well.
Working.
So that
Okay.
will be a diagnostic test for diabetes or gestational diabetes.
Okay.
So that's what they did was it's called oral glucose tolerance test.
So they now said everything was fine.
Yeah.
But I'm wondering, they did the test initially. What prompted them to repeat it? What could be the result that will now make them repeat it?
No,
Was it
it's routine. It's routine. All pregnant women, when they do the regular one, they also will do the oral glucose tolerance test. It's routine.
okay?
Yeah. So
Be-
it's not any big deal. Yeah. It we did for pregnant women.
Oh,
Yeah.
okay. Because at the time, one time in my life, I was hypoglycemic.
Yeah. Yeah. Yeah.
I stopped taking anything sweet. I'll go to parties, no drink.
Oh, because of it.
They'll be drinking my, illiterate now. They'll be drinking my house. I will not drink. Anything see, you can never see candy in my house, nothing. It's
Oh
just
my God.
food. And so I noticed that started becoming weak. So what helped me one day, I was climbing the step. I could not climb step very well. So what's going on? I always tell my husband that I'm not feeling fine. You say go and rest. After resting, I'll still be weak. So I said, let me just walk down, go and see a friend. She's a pharmacist, just to stay with her for some time, then climb upstairs. I think I was on leave or so. And I sat down with her. She said, look at the way you are feeling. Are you okay? I said, I'm just feeling weak all the time. So she now did the test. When she did the test, she shouted. She said, how did I get here? Hey, quickly, she brought out Coke from her fridge. I said, I don't drink Coke. He said, drink it. I started drinking. And he called my husband. He said, buy a carton of drink, buy everything for her sugar. I said, me, I don't drink, I don't like. He said, after another 30 minutes, take another one, take. So it was when I started this nursing. I now remember, I said, oh, that's why she did that thing. I never knew. She told me, but I did not understand. So I can't hear you.
Yeah, sorry, I muted. I
Yeah,
said we'll still talk about it because hypoglycemia is also a major, even that kills more than hyperglycemia,
yeah, that's what they say.
kills faster than hyperglycemia. And there are protocols on how to deal with it if the patient is at home, or if the patient is in the hospital, or if the patient is unconscious. There are protocols that we use because that's what NCLEX was also asking.
Mm-hmm.
But yeah. So you made us skip some slide because of your question. So
Correct.
a patient is coming to the emergency department with
With
hyperglycemia.
so it is found that the client's pancreatic beta cells have been destroyed.
Mhm.
The client will be diagnosed with which type of diabetes? Mm, have been destroyed. It's type 1.
Perfect. That's type 1. A patient, okay, read this.
Can you tell me why it's type 1?
When the pancreatic cells have been destroyed, do they still produce insulin?
No.
No. And it's caused by maybe an autoimmune condition. But type 2, they produce insulin, which means the pancreatic cells may still be working, but it's just that this insulin is not doing its job.
Okay.
So this patient is type 1.
Okay. A
Okay.
patient with type 1 diabetes asks why they need to take insulin. Hmm. The nurse explains that their body produces too much insulin. Their body does not produce insulin. Their cells are resistant to insulin. The body can use glucose without insulin. The answer is B. B.
Yeah. 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 Correct. Okay, you've not done this. We've not talked about it, but you
Let me
should,
try. Yeah.
yeah, you
Let me
should be
try.
able to.
I might know it because
Yeah.
I'm reading. A patient with diabetes mellitus presents to the emergency department with confusion, sweating, and palpitation. Which of the following is the nurse priority action? Confusion, sweating, palpitation is hypoglycemia. Which of the following is the nurse priority action? Administer glucagon intramuscularly. We present to the emergency. Okay. Emergency department, which means probably the person is even unconscious. I will choose A, then provide 15 grams of a fast carbohydrate. No. Obtain a blood glucose level. Which of the following should 50% dextrose IV push. A and D looks correct. But A and D, I'm still glucagon intramuscularly. Dextrose IV push. A and D, I don't know what to choose.
When you went to your friend's house, what did she do first?
She gave me simple carbohydrates.
No, before she gave you a simple carbohydrate, what did she do?
She checked my blood glucose.
So why can't you check the patient blood glucose level first?
Hey, it's true.
We did it yesterday. You forgot to.
Yes. You know what I always think? I'll say the person is already in emergency.
Don't think too much.
Hey, you
Don't
already
put
know
things
that you
that
have it. Hey,
don't put see.
oh,
They said the patient was confused, which means the patient was still unconscious. The patient was not unconscious.
yes.
Because you can't, yes. The patient, a patient with diabetes presents. The patient was not rushed unconscious. And even if the patient was unconscious, the first thing you do is to do what?
Check the blood
Check the
glucose.
sugar level. Even if they are unconscious.
Even if it's emergency,
Even
just
if
do
it's emergency. Before you give anything, you check the blood sugar level.
check. Assess is always first. Assess.
But then, if they had put the patient came to the emergency department with sweating, confusion, palpitation, her blood sugar level on presentation was, let's say, 64.
Mhm.
Then you may not need to check again because that has already been checked.
Yes, it's true.
But they didn't say that they've checked the sugar level. The person just presented.
Mm.
So always check. Always assess your patients. Not always, but it's context dependent. So
Mm-hmm.
in this context, before you do anything, you need to have, okay, if you give, let's say you give glucagon, what was the sugar level before you gave the glucagon? Remember, you remember the 15, 15, 15.
Yes.
You check, you administer 15 grams. After 15 minutes, you check again, you
Yeah.
admit, yeah. So that is it. That is it. Okay. I think I have a meeting now. We're just gonna do for 2 hours, and that is it. I thought we are gonna finish this, but it's not about finishing it, it's about understanding the concept.
Okay. We started by 1, right?
We started by 1 and we are ending by no, we started by 12.
So
12. The time says 1 hour 58 minutes.
let's see. I can't even remember.
Yeah, no, I'm recording it, so you'll
It's
see.
true. It's true. So short.
So short. So short,
I'm
yeah.
already lecture. I don't want you to go. Do you know
Yeah.
half of this business school I went to? God forgive me.
No, it's okay. It's
I like
okay.
nursing so much. The way it is so interesting, but I don't know it.
Yeah, yeah, don't worry. You will
I
know
don't
it.
have
And
an
again, when
answer.
you start practicing, you also know more because you can't know everything at once.
Yeah.
When you start practicing, you will still know more. Okay?
Yeah.
All right. So I will send you the recording. Now the problem with this recording is that sometimes it is
Hmm.
too large to be sent to through WhatsApp. So
Okay.
I always upload it to a LinkedIn platform. No, not a LinkedIn platform, to a YouTube platform. So I can
Okay.
copy the link. You can watch it directly. Because if I say I should send it to you, it's too large.
So
You
like,
cannot,
okay.
yeah, I can't
Just
send.
do it the way you want to do it.
All right, all right.
You're
Okay,
always correct. Just do it.
no problems, no problem. Okay. All right,
Thank
thank
you.
you. Yeah,
I
so
appreciate
yeah, I'm going to
it.
stop recording. I'm going to stop recording now. Just give me a second.
Okay.